Hello, hello. Hi, everybody. Welcome to today's health talk. It's actually our first one. And today we'll be talking about the importance of lung cancer screening. So as a brief introduction, my name is Alex. I am the VP of Community Health Programs here at VCSA, the Vietnamese Culture and Science Association. And we're just launching off a new series of health talks, having discussions with different community organizations that want to help promote the health of the Vietnamese community. And today I am joined by RICE, the American Lung Cancer Screening Initiative chapter. Let's see, Priyanka, would you like to introduce yourself first?
Yeah, sure. Thanks, Alex. I'm really excited about the opportunity to present to you all today. We are the Rice American Lung Cancer Screening Initiative, which is a club on campus, and our mission is to raise awareness about lung cancer and lung cancer screening. As we'll talk more about in our presentation, lung cancer is the deadliest cancer in the world, and there are several different reasons for why this is. With the root cause being partly due to a lack of awareness and education about lung cancer screening, which is going to be the best way for us to detect lung cancer early. And so our team, composed of undergraduates here, is working to raise awareness in the Rice and Houston community specifically. And we've in the past had canvassing events where we've talked to the public about lung cancer. We've worked with the mayor before, and we've also organized events on Rice's campus. And so in addition to these efforts, we also love doing presentations like this one to connect with students and other individuals who might be interested in learning more. So thank you again for the opportunity.
No problem, no problem. Thank you so much for coming out today. And your colleagues, would you like to introduce yourselves?
Hi, everybody. My name is Nathanael Mathew. I'm the secondary student leader here at Rice ALCSI. I'm excited to be able to do this presentation and answer any questions that you guys have.
Hi, everyone. I'm Pranav Mandiam, and I'm the treasurer of Rice ALCSI, and I'm excited to be in this presentation and answer all the questions.
So I'm going to go ahead and I will share a recorded presentation that your chapter has graciously provided to us. And during this presentation, please feel free to type any questions or comments you might have in our live Facebook comment stream, and we will try our best to answer it during the Q&A session that follows, and if possible, in the comments itself. All right, so let me go ahead and put that on screen. And thank you again for joining us today.
Vietnamese people with over. Hello everyone, my name is Nathanael Mathew, and I'm a member of the Rice University chapter of the American Lung Cancer Screening Initiative, or ALCSI for short. Today, we will be giving a presentation on lung cancer and lung cancer screening. We are grateful for this opportunity to present to you. Before we get started, I'd like to request that if anyone has a question, we will have a member of the ALCSI team ready to answer questions during this Facebook Live session, so feel free to ask any questions in the chat option. If you're interested in learning more about ALCSI, we'd like to invite you to visit our website at www.alcsI.org, and please email us with any questions at any time. Before I get into the content of this presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. We are a team of over 70 passionate students and doctors located across the United States. We've worked with community organizations like the South Asian Network and American Cancer Indian Foundation, as well as city and state health departments, including the NYC and Connecticut health departments. We hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. Today, we will discuss both lung cancer and lung cancer screening, addressing questions such as how common is lung cancer, what is lung cancer screening, and how can you get screened? We're excited to present this to everyone listening at the Vietnamese Culture and Science Association. To start things off, lung cancer is very common. It is the second most common cancer in the US, excluding skin cancer. This graph shows the American Cancer Society estimates for the number of new cancer cases in the United States. This graph estimates new cancer cases in 2022 for the 4 most common cancers. As you can see, it is estimated that 236,740 people will be diagnosed with lung cancer in 2022 in the United States. To put this number in perspective, it is estimated that about 6% of people will develop lung cancer during their lifetime in the US, That means about 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. Moreover, not only is lung cancer very common, it is also very fatal. Lung cancer is the leading cause of cancer related to death in the US and the world. In 2022, it is estimated that lung cancer will claim the lives of 130,180 people. This graph shows the American Cancer Society estimates for the number of cancer-related deaths in the US. As you can see, lung cancer is far more fatal than breast, prostate, and colon cancer, causing more deaths than all of these three combined. Lung cancer makes up almost 25% of all cancer deaths, resulting in about 350 deaths each day. Every year, there are about 50,000 more new cases of breast cancer, but lung cancer causes over 90,000 more deaths. If we look at lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest on Black males at an incidence rate of 71.7 per 100,000 people. Among females, lung cancer incidence is highest in white females at an incidence rate of 51.1. Mortality rates mirror incidence rates, so Black males have the highest mortality rate amongst males, while white females have the highest mortality rate among females. From this data, the question that arises is, why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at a later stage. This is a graph looking at the proportion of patients with lung cancer by stage. Stage is a way for doctors to classify a cancerous tumor based on tumor size, if the cancer has spread to lymph nodes, and if the cancer has spread to other locations in the patient's body. Currently, most lung cancers are diagnosed at a distant stage, when the cancer has spread beyond the site in the lung where it originated. This graph is based off of data from 2008 to 2017, published by the National Cancer Institute. As you can see, about 21% of patients are diagnosed at a local stage, while about 51% of lung cancers are diagnosed at a distant stage, when the cancer spread to other locations in the body. So why is this important? It's important because the stage that lung cancer is diagnosed at correlates directly with survival. We'll see in this slide. One way that doctors track the survival of patients is by looking at the 5-year survival. As you can see here, the 5-year survival for lung cancer at the early stages is high, but the 5-year survival significantly drops as the disease progresses. This graph is another way to understand the relationship between the stage of diagnosis and 5-year survival. The 5-year survival for patients with localized lung cancer is 59%, but only 23% of lung cancers are diagnosed at that stage. In comparison, nearly half of lung cancers are diagnosed at a distant stage. And this is why early detection of lung cancer is so important. If we can detect lung cancer at an early stage, then treatment options are better and prognosis is better. With lung cancer being such a morbid disease, some of you might be wondering why the majority of lung cancers are diagnosed at a later stage. Well, the majority of patients are diagnosed with late-stage lung cancer because they don't start feeling any of the symptoms of lung cancer until the cancer has grown and spread. The most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset wheezing. However, when people become symptomatic, the cancer has grown and spread to a point where it is more difficult to treat and the prognosis is poor. If the diagnosis of lung cancer has to wait until the patient has symptoms, it is difficult to catch lung cancer early. So the question we ask is, how do we catch lung cancer early if patients are asymptomatic? One of the best ways that we can do this is through lung cancer screening. Lung cancer screening is done using something called the low-dose computed tomography scan. If you're eligible for lung cancer screening, it is recommended that you get an annual lung cancer screening. In the coming slides, we will discuss what lung cancer screening is, who should get screened, and how to get screened. An important distinction we want to make is that lung cancer screening is done using low-dose computed tomography, also known as low-dose CT, and not the chest X-ray. We use low-dose CT scan because it provides more detailed pictures than chest X-ray, and it's better at finding small abnormal areas of the lung. The picture on the left is a picture of a chest X-ray. The yellow arrows point to the abnormal area in the lungs, but it's unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest. The red arrow points to the abnormal area in the lungs. As you can see, this image is more detailed than the chest X-ray and enables you to see abnormal area in the lung with greater detail. The question that researchers wanted to answer is, how effective is a low-dose CT scan at detecting lung cancers at an early stage? An important lung cancer screening trial called the National Lung Screening Trial, or NLST, tried to answer this question. The NLST was a large national study with over 50,000 patients. The goal of the study was to determine the effectiveness of using a low-dose CT scan to detect lung cancer in patients considered high risk for lung cancer. The study included two groups, a group of patients who received annual low-dose CT scans and a group of patients who received an annual chest X-ray. By comparing the stages at which cancers were caught between these two groups, the study wanted to determine if the low-dose CT scan was better, catching more lung cancers at an early stage. As you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an early stage, while the X-ray diagnosed more patients at stage 4. This has important implications for survival. Because the low-dose CT scan caught more lung cancers at an early stage, these cancers were more likely to be treatable, and the prognosis was much better. This translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to an X-ray. A concern with any screening test is accuracy. Essentially, how good is a low-dose CT scan catching lung cancer? For every 100 individuals undergoing CT lung screening, 75 will be negative. Of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. This means that the test is very good at identifying people who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive and the test will not miss your cancer. If we move our attention to the 25 individuals that are positive, 23 turn out to be negative for cancer, primarily with follow-up imaging alone. This means that even if your test result is a false positive, it's really easy to rule out cancer using further non-invasive imaging. The two individuals that have a positive test result and truly do have lung cancer are more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening. This means that their treatment options and prognosis are better. The results of the NLST were published in 2011, 10 years ago. Several studies have been published since then, further confirming the life-saving benefit of lung cancer screening in high-risk populations. One of the most important is the Nelson trial. In February of 2020, the results of the Nelson trial were published. Like the NLST, the Nelson trial had two groups. However, unlike the NLST, the Nelson had a group that received low-dose CT scans and a group that received no screening of any kind. A total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at T0 or baseline, year 1, year 3, and year 5.5 or no screening. The results confirming the life-saving benefit of lung cancer screening by low-dose CT. In the screening group, 58.6% of lung cancers were diagnosed at a stage 1. In the non-screening group, 13.5% of lung cancers were diagnosed at stage 1. Early detection translates to a reduction in mortality. In the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to no screening. The Nelson trial also showed that with improvements in low-dose CT technology, the false positive rate was reduced significantly. Lung cancer screening significantly reduces lung cancer mortality, but who should get screened for lung cancer? The United States Preventative Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 50 and 80 who have a 20-pack year smoking history or greater and who are current or former smokers who quit within the past 15 years get annual low-dose CT scans. The current screening guidelines require you to have a 20-pack year smoking history. Now, pack year is probably a term that most of you have not heard before, but it's just a way for doctors to track your smoking history over a period of time. A pack year is defined as smoking a pack of cigarettes per day for a year. So for example, if you were to smoke 1 pack a day for 20 years, that would equate to a 20-pack year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate to a 20-pack year smoking history. The important takeaway is that there are many different ways to reach 20 pack years, and the pack year is a way to help doctors track your smoking history. I'd also like to point out that the USPTF guidelines were recently updated. The USPSTF had slightly different guidelines previously and updated their screening guidelines on March 9, 2021. The previous screening guidelines only recommended that individuals between the ages of 55 to 80 with a 30-pack year smoking history or more get screened. Under the new guidelines, the lower age bound is lowered from 55 to 50, and the pack year smoking history is lowered from 30 pack years to 20 pack years. These new guidelines will nearly double the number of eligible individuals for lung cancer screening in the US. Notably, the most apparent increases in eligibility will occur among women and minorities. However, while these new guidelines will include more high-risk individuals, they only include individuals with heavy smoking histories. There are other risk factors for lung cancer that are not accounted for in the current screening guidelines. Smoking is a primary risk for lung cancer. When compared with people who have never smoked cigarettes, a current smoker has a 25 times greater risk of lung cancer. About 8 out of 10 or 81% deaths from lung cancer in 2022 are expected to be caused from smoking cigarettes. After smoking, the next leading cause of lung cancer is exposure to radon gas, which is released from soil and can build up indoors. Moreover, secondhand smoke causes almost 3% of new diagnoses of lung cancer and is expected to cause about 3% of deaths from it in 2022. Additional risk factors include exposure to asbestos, family history of lung cancer, COPD, and previous radiation therapy to the lungs. It's important that we recognize these additional risk factors because although lung cancer has a strong association with smoking, there are a large number of people in the United States who have never smoked that still get lung cancer. Never smokers are defined as individuals who have smoked less than 100 cigarettes in their lifetime. Because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses and is the 8th leading cause of cancer-related death in the US and world. More never smokers die from lung cancer each year than people die from ovarian cancer. This graph shows a proportion of lung cancer cases that occur in people who have smoked in their life and people who have never smoked. It is then further broken down by whether they are a current, former, or never smoker. As you can see, 80 to 90% of lung cancers occur in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. Interestingly, women are more likely to be never smokers when diagnosed with lung cancer. In fact, in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. Right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding lung cancer in never smokers is a current focus of research. With the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should be screened for lung cancer. In summary, lung cancer is a leading cause of cancer-related death in the US. It's so deadly because most lung cancers are diagnosed at a late stage when they have spread to other locations in the body. Importantly, early detection through lung cancer screening by the use of low-dose CT can reduce lung cancer mortality by up to 33%. Currently, only 5.7% of high-risk individuals are currently getting screened for lung cancer. To highlight how low this number really is, we compared a lung cancer screening rate to the screening rates for breast, cervical, and colon cancer. All 4 of these cancers have screening rates that are recommended by the USPSTF. Right now, only 5.7% of high-risk individuals are getting screened for lung cancer. This rate is extremely low in comparison to the screening rates for breast, cervical, and colon cancer. The American Lung Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the US, we would save 48,000 lives. However, we are only screening 5.7%, which means that a lot of lives that could be saved are not being saved. And why is that? The lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening, the cost of screening, and the safety of screening. In the next slides, we will discuss each of these topics. The important takeaway, though, is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. The first potential concern we will address is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there are a few exceptions. Medicare will only cover lung cancer screening until the age of 77. Not all state Medicaid plans cover lung cancer screening, and patients will still pay the usual fees for provider appointments before or after the scan. As I just mentioned, unfortunately, not all state Medicaid plans cover lung cancer screening. Here is a map updated in September 2021, showing which state Medicaid plans do and do not cover the lung cancer screening. Blue states have state Medicaid plans that cover lung cancer screening. In purple states, their state Medicaid plan does not cover lung cancer screening. In pink states, the particular information is not available. The first step to getting a patient screened for lung cancer is having them talk to their primary care provider. There are certain questions the primary care provider has to ask and topics that have to be discussed. One of these is the patient's 5-year smoking history, which we saw how to calculate in earlier slides. To find accredited lung cancer screening centers, patients can go to the American College of Radiology website. They can type in the state or city they live in to see where accredited lung cancer screening facilities are located near them. The American College of Radiology website is listed on the bottom left-hand side of the screen. This is a map of accredited lung cancer screening facilities in Massachusetts. As you can see, each red pin represents an accredited screening center. That way, if, let's say, you wanted to find an accredited screening center and you happen to live in Massachusetts, this would be a very effective way to do so. As far as how the experience of getting a low-dose CT scan goes, it will require you to lay on your back for about 5 minutes. You'll be doing something very similar to the patient in the photo here. One thing to note is that this process will not hurt at all, and because this is a low-dose CT scan, you do not use contrast. This means that there will not be any needles or injections involved. The low-dose CT scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation exposure is actually very low. The way that doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. It is just a way to measure radiation and compare the levels of radiation received during different activities and over time. For a low-dose CT scan, you'll be exposed to 1.5 to 2.0 millisieverts of radiation. This is a lot lower than a full chest CT scan, which requires a radiation dose of 8 millisieverts. To put that in perspective, you are exposed to 3.11 millisieverts of radiation a year, just from breathing, cosmic radiation, eating, and the radiation from the earth. So a low-dose CT scan exposes you to less radiation than you're exposed to from just existing on Earth, which means that the level of radiation you receive from an annual lung cancer screening test is actually quite small. That being said, this is always something that patients can discuss with their primary care provider. So a patient talked with their primary care doctor. The PCP referred the patient to a screening center and they received a low-dose CT scan. What's next? The doctor will receive the results of the patient's screening test and will follow up with the patient to go over the results. As far as results go, there are 3 more likely outcomes. The first outcome is that the scans are normal. If that is the case, then the patient should look to get repeat scans in a year. If the scans are abnormal, but probably benign, then the patient should talk to the doctor about the next steps. This may include more scans, tests, or biopsies. If the scans are abnormal and suspicious, then the patient will most likely have to undergo additional testing like biopsy. So lung cancer saves lives, but a question you may be wondering is, can individuals still get screened for lung cancer during COVID-19? And is it safe to do so? During the pandemic, the number of cancer screenings has decreased significantly. However, lung cancer won't stop because of the pandemic. If a patient is at high risk for developing lung cancer, it's important that they get their annual lung cancer screening test. Right now, most hospitals have operating lung cancer screening programs, and patients can wear masks during the entire lung cancer screening process. If patients follow the necessary precautions like wearing masks, lung cancer screening during the pandemic is safe. The pandemic should not deter patients from getting screened for lung cancer. Another question we often get is how vaping and e-cigarette use affects lung cancer risk. Vaping and e-cigarettes are a relatively new phenomena and have become more prevalent in the last decade. While the long-term effects of vaping and e-cigs are still being studied, it is clear that for individuals who have never smoked before, they can increase their risk of lung cancer. E-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. These arise both as elements of the e-liquid and as a result of organic reactions in the electronic cigarette device. Various studies demonstrate in vitro transforming and cytotoxic activity of these derivatives. Vaping causes fewer health risks than smoking, but it's not a risk-free activity. Vaping can increase heart rate, decrease air volume in lungs, and increase airway resistance. Furthermore, e-cigarette device use has been significantly increasing, particularly among young adults and non-smokers, making it an area of significant concern for the future. Additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not a substitute for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is the best way to detect lung cancer early. Using both is the best way to fight the disease. For every year after an individual quits smoking, the risk for lung cancer reduced by 8% to 17%, depending on the kind of lung cancer they have. Another reason that smoking cessation is important is because it is required by Medicare and Medicaid services for lung cancer screening programs. However, we do understand that smoking cessation can be difficult. There are a lot of resources for people trying to quit smoking. Some great programs are the renowned Health and Wellness Quit Smoking Program and the Nevada Cancer Coalition's Quit Smoking Program. Big question that may come up is, why should we care? Well, it turns out that lung cancer is a major cause of death for Vietnamese people, with over 20,000 annual deaths. Furthermore, there are 667 newfound Vietnamese lung cancer cases annually. Looking at smoking, 66% of adult men in Vietnam are current smokers, and Vietnamese Americans have the second highest prevalence of cigarette smoking among Asian groups, with over 16%. Looking at these statistics, it's clear that this is an issue in the Vietnamese community. As this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate. Lung cancer is the deadliest cancer in the world, and while lung cancer screening can save so many lives, very few high-risk individuals are currently getting screened. We are working to address all aspects of this issue. We wrote and advocated for House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. Last December, our Senate resolution was passed by unanimous consent. Additionally, we are working to teach communities across the country about lung cancer and lung cancer screening. Lung cancer is the deadliest cancer in the world. By working together, we can overcome it and save millions of lives. It starts by working together to raise awareness, initiate lung cancer screening programs in our communities. We believe that educating communities, especially students, about lung cancer and lung cancer screening is crucial to lowering the number of deaths associated with the disease. Individuals in the community greatly impact the influence of healthcare of other people, such as family and friends. And we hope that by educating you all, you can take these important measures and hopefully bring this awareness to others. Okay, so now I'd like to open up the floor one more time to questions that you may have, and feel free to put it in the chat where a ALCSI representative will be able to answer.
All right. Thank you so much for that presentation. And I learned a lot personally, and I think it had a lot of important information that not only the Vietnamese American community can benefit from, but just any person who wants to promote health for themselves, their families, and the people who they care about around them. So thank you again for having the presentation. I guess one question I've had is, you mentioned Lung Cancer Awareness Month. What is that month? Or can you give more information about that?
Yeah, thank you for the question. So Lung Cancer Awareness Month is in November. And so not a lot of people actually realize that. And so that's one thing that we are trying to work to raise awareness about, because, we've made really great progress with breast cancer. And a lot of people know about October being Breast Cancer Awareness Month. And, whenever you see a pink ribbon, it's indicative of breast cancer awareness. And so there are a lot of efforts that have been put towards like breast cancer awareness campaigns, 5K runs, etc. And that has really helped to increase the breast cancer screening rate. And like we saw in the presentation, the breast cancer screening rate is around like 76%, which is amazing. And, we really admire those efforts, and we think that similar efforts need to be put towards lung cancer. And November is Lung Cancer Awareness Month, so it's a great time to hold events and also just talk to people about lung cancer screening.
Awesome. Well, I hope that, it gets more promoted so that it can be, as we always talk about Breast Cancer Awareness Month, but I think lung cancer is definitely an issue that we need to have put more focus on. So we actually have one question in the chat so far. Let me go ahead and put it on screen. Is there any way to look for early clues that you might have lung cancer? Like, how can you check yourself for early signs of how you can check yourself for early signs of breast cancer or skin cancer? I used to actually work for a dermatologist, and she would always tell her patients, okay, make sure to check yourselves every year for maybe lumps, suspicious moles. Is there something similar that you can do for lung cancer, especially if you maybe don't know about screening, or maybe you don't know where the nearest screening center is?
Hey, that's a great question. Thank you for the question, Sarah. So the main symptoms that we really think about when it comes to lung cancer are things like chronic cough, coughing up blood, chest pain, shortness of breath, and these are kind of like things that actually come on later on when the cancer actually progresses. So that's one of the main reasons we're really stressing the idea of making sure that we get lung cancer screening early on, because the signs and symptoms are not so obvious. And when these signs and symptoms do become obvious, it's oftentimes too late. And when you catch the cancer later on, the prognosis is not as good. And that's why we're really emphasizing the importance of making sure that we have lung cancer screening for those individuals that need it.
Oh, thank you. Another question is, this isn't from an audience member, but another question I had. Is lung cancer screening a service that you can easily provide at like local health fairs? At BCSA, we do a lot of these health fairs for the Vietnamese community, or we're involved with coordinating some. And a lot of our community members that we've noticed, especially those who are uninsured, they attend these events at cultural, religious centers. But I personally have not seen lung cancer service being offered at these events. Do you have any thoughts about that?
Yeah, there are a few reasons why lung cancer screening unfortunately cannot be offered at these local health fairs. One reason is because, like we saw, we need a CT scanning machine, and that is, it's going to be in only certain hospitals, and so it's not a portable machine that can be easily transported, and so that's one of the big barriers to offering lung cancer screening in like a local fair. But additionally, there are a few requirements that patients need to go through before they can get a scan. And so, for example, in order to even schedule a CT scan, the patient needs to be referred by their doctor to get the scan. And so one thing that we are trying to do to increase the number of people who can get screened is we're trying to work with local doctors in different locations and regions, so that if a patient or a person attends one of our events and realizes that they meet all the lung cancer screening guidelines, and they want to get a scan, then they can talk to this physician who might be able to refer them to get a scan. And so doctors oftentimes have limitations on the regions to like within which they can refer patients, and so that's why we're trying to work with doctors in different states and different locations to help patients in those areas get screened if they meet the screening guidelines.
Okay, that makes sense. Do you foresee that possibly changing in the future as maybe the technology develops to make it a lot more accessible?
I think it's possible. So, for example, the Centers for Medicare and Medicaid Services just very recently on February 10th expanded their coverage. And so now patients who are 50 to 80 rather than 55 to 80, and those who have a 20-pack-year smoking history rather than 30-pack-year smoking history are eligible to get coverage for lung cancer screening. And so there are steps being taken to increase lung cancer screening accessibility, which is wonderful. And I think we're on the right track. But I think it'll definitely be a long time before we can start offering lung cancer screening and at like a local fair. Not just because of the technology, but also because in order to get covered for lung cancer screening, there are extra requirements that are in place when compared to the screenings for like breast and cervical cancer, like a shared decision-making visit where a patient actually has to meet with a doctor and have a formal meeting and discuss. There's several different topics that need to be discussed before a patient can even schedule a scan. And so due to those extra requirements, there are a few more hurdles and that we need to overcome before we can offer lung cancer screening on a wide scale.
Okay, that makes sense. Yeah, I guess that ties into my next question actually about how the ALCSI is helping individuals without access to healthcare insurance get access to these lung cancer screenings. And you've answered a lot of it already. If you had anything else to add, feel free.
I think that pretty much covers what we're doing to help like individuals who are maybe do not have access to a physician who can refer them, and so that's one of the big projects that we're working on. But in addition, as we see, like in communities, there's just a lack of awareness about lung cancer and the screening guidelines. So even individuals who are heavy smokers might not have even heard of lung cancer screening. And so I think one of the best ways is to really just have, talk to these individuals and reach out to healthcare community health centers and different organizations and ways that we can work with these individuals and community leaders like mayors and governors to increase awareness about the lung cancer screening guidelines.
Okay.
So, we hope that all of our efforts together can increase the number of people who can get screened.
It'll take a whole bunch of different things, a lot of partnerships, a lot of talking, a lot of communication. Communication is always the backbone behind any sort of healthcare access, increasing access. Well, thank you for that. We actually have another audience question from David. If vaping increases the risk of lung cancer, do you recommend that people who have vaped for many years get a screening? I know during your presentation that there's still a lot of research that's being done, but do you have any preliminary suggestions for people who know of others who might vape a lot because they think it's like a replacement for actual smoking?
So because vaping is a relatively new phenomenon right now, we still don't really we know that vaping, like for a person who hasn't smoked, so for a never smoker, vaping definitely can increase the risk for lung cancer, but we're not really sure what the long-term effects of vaping are, and so they are still currently being studied, and as a result, vaping and e-cigarette use is not currently taken into the lung cancer screening guidelines, and more research is going to be needed before we can determine, how many, when patients or people should get screened if they vape or use e-cigarettes. And so there isn't a definite answer that we can provide right now, but I would just recommend people to know and also share the information that vaping, it is not a risk-free activity, because a lot of people think that vaping and e-cigarette use are safer than smoking, which is right, but it's not a risk-free activity by any means, and so it can increase the risk for lung cancer. So right now we can't provide like a number of years after which people should get screened for lung cancer if they vape. But if this is something that you're concerned about or someone else is concerned about, then you can always talk to your primary care physician about this, and they can help you determine what will be right for you.
Yeah, the best answer is always talk to your doctor. Okay, well, thank you for answering that question. Another audience question, this one's in Vietnamese, I can translate it. Basically, Karen is asking, she has a weak lung. Is it possible that she might have lung cancer? Now, this is a very general question, so it's okay if you don't want to offer any specifics, but do you have any general advice for people who might be concerned about the state of their own lungs?
I think the advice that I would give here again is, there are a variety of different possibilities for this, and I think that the best answer that I can give you is just talk to your doctor again. That there might be like tests or things that are scans, that the doctor would recommend, like depending on maybe your personal medical history, and so I think your physician who knows you best will be able to provide a better answer.
All right. Thank you for that. Another question I had is, VCSA has a very big emphasis in public health. And we have noticed that language access is a big barrier to individuals receiving care, especially through our efforts to get COVID vaccinations out to the community. You know, all of those websites are mostly in English or Spanish, but they leave out a lot of Asian languages, which is another accessibility barrier. Have you seen language access been a big barrier to people in communities receiving lung cancer screenings? Or not just for the Vietnamese community, I assume, but for maybe Asian American communities or other POC communities in general?
Yeah, I definitely think so. Like you were talking about, a lot of the infographics and information on lung cancer and lung cancer screening is presented in English, which is a barrier for individuals who might speak a different language or whose native language is something other than English. And so there are efforts to increase the number of educational information and resources in other languages. Primarily, I think the second most common is probably Spanish. So there is a lack of, there's only limited resources that are in other languages, and so I know our organization as well as other organizations are working to provide resources in these other languages, but that I think is definitely a barrier right now, since when a patient talks to their doctor, not only do they need to try to decipher what the doctor is talking about in terms of medical terms, because usually that's new information, but also if it's in a language that is not their primary language or is not a language that they're fully fluent in, that adds in another stress and challenge during the meeting with the physician. And so all of this can just increase the can make it harder for the patient to really understand their condition and do what is recommended, whether it be getting a scan, etc. And so it's really important that we do make these resources more accessible and provide presentations in different languages. So I know ALCSI has given one in Spanish and Chinese, and so but we definitely need more efforts and towards this as well.
Well, thank you so much for, of course, trying to promote health in different communities that may not have that same access. My last question was just going to be, why did you all want to reach out to the Vietnamese American community to promote this type of education?
Yeah. So obviously, the health of an individual really, if you look at the community level, a lot of impact can come from that, right? Because if you belong to a community, if your friends, your neighbors, or your relatives are being part and taking care of their health, then you also will be influenced by that. So by really looking at the community level in targeting these health disparities and these health issues, not just for lung cancer, but for any public health issue, we can really make an impact, right? And so starting at the community level, we reached out obviously to many different organizations, but hopefully in reaching out to the VCSA, we were able to spread this word among the Vietnamese community. And I know that the Vietnamese community through VCSA has many health initiatives like the health fair. And so through initiatives like those, we hope to really spread the message so that you, whoever is listening right now, will be able to spread this message for your own sake, for the sake of your grandparents and for your children. And I think that's a really strong testament to the strength of making a health impact through at the community level.
Thank you so much. Very beautiful sentiment. And thank you, Pranav, for adding this in too. If there's any students out there who, or I guess if you want to explain your comment, you can go ahead and do that, Pranav.
Yeah, sure. So there are many different ways that students can get involved with the ALCSI. So one way is to join our ALCSI chapter, or you can join an ALCSI chapter at your school, or start your own ALCSI chapter if your school doesn't have one already. And you can always contact info@alcsi.org if you're interested in any of these. And also, if you know any businesses or organizations, community centers, or schools who would be interested in having us present about lung cancer, then please let us know. We're always looking out for opportunities to present to the community.
All right, and I guess that'll wrap up our Q&A portion. I just wanted to give y'all an opportunity to I have your website pulled up here. If y'all want to just give a brief blurb about it, feel free.
Yeah, for sure. So here at RALCSI.org, or RALCSI as we like to call it, you'll see the Rice American Lung Cancer Screening Initiative chapter, and you can look at different information. For example, if you go ahead and click the lung cancer tab, there's some statistics as well as some information about lung cancer to help educate you. If you look at the screening tab, there's actually a link to a website that will actually it will show you the screening guidelines as well as a link to a place where you can actually find an accredited screening center. And if you have questions about what is low-dose CT scan, how exactly does the screening work, what's the impact of radiation, those are different things that are in there as well. And if you look at what we do, there are different initiative that RALCI and ALCSI has done. And definitely you can check those out. And yeah, and if you have any questions, feel free to reach out to us through social media or through our emails listed, and we'd be more than happy to help you out.
All right. Well, thank you so much, y'all. Today I learned a lot personally, and I hope that other community members are able to take away some knowledge too. It looks like we've got a lot of community members on our chat today who learned a lot. And I will just go ahead and take a moment to explain a little bit about why VCSA is wanting to help promote this information. So essentially, over the past 2 years, we've learned, the entire world has seen the importance of health. We've had a global pandemic that is still ongoing, and it's really put a ripple into our society. So seeing the impact that it was having on Vietnamese community members, people who are left out because they couldn't get to the vaccines because of language barriers or technology issues, maybe didn't have a car to get to vaccination sites. We worked with a bunch of different partners from the city of Houston to pharmacy groups, doctors groups, and other people in Houston wanting to make a difference, and helped coordinate over 3,000 vaccines and testing appointments and COVID-19 tests for Vietnamese American Houstonians specifically, but just for people who have been left out and were needing access to health. And so over the past year, we've also had health fairs. We've worked with different groups in coordinating health fairs. It is all only made possible by volunteers, like especially students from Rice, but students in general have been really quick to step up and give their time to serve their community members and serve their elders, serve the generations before us. And I want to just also say, if anyone is interested in working with VCSA as a volunteer, maybe you want to get involved and help coordinate a project, or if you want to give a talk and present to our community and promote health, just like Rice ALCSI is doing today, please feel free to reach out to us through our Facebook. We have a website, or just email us, and we'll be more than happy to work together to create a more thriving and healthy community for all of us. And with that, I'm going to go ahead and just give another shout out and thank you to Rice ALSCI. Thank you, Priyanka. Thank you, Nathaniel and Pranav, for talking with us today. Are there any closing thoughts you have that you want to just share to the community here, or maybe to other students out there wanting to get involved with health, lung cancer screening, giving back to the community?
Well, first of all, thank you, Alex, for this opportunity. It was a wonderful opportunity to give this presentation to you guys, and we really appreciate everyone who's here on a Friday evening to learn more about lung cancer screening. And for students who are interested in joining, we're always looking for more help. And so if you have any ideas, or if you just want to learn more about what ALCSI does, please feel free to reach out. We're always looking to have more people on our team. And if you're interested in public health, then I would recommend just doing what interests you. It's a great time to explore different interests, and we really need more people who will work to increase awareness about different diseases, and just communicate information that might not be getting communicated to everyone. And so just do what interests you. And thank you everyone for joining. Thank you, Alex, for the opportunity.
All right. Thank you so much again. And I hope y'all have a great night. Please feel free to reach out to us anytime. And to everyone watching today, thank you for watching and commenting. Please stay healthy. We'll get through this pandemic together, and stay safe out there. All right. Thank y'all.